Well, as students across the state return to the classroom this week, one of New Jersey's largest high schools is doing so without a support system that many say is essential: school-based mental health services. The Hunterdon Central Regional High School Board voted last month to end partnerships with two longtime providers just 10 days before classes began. The decision has sparked backlash from parents, students, and staff, especially in a district where teen suicide has left lasting scars. I'm joined now by our mental health writer, Bobby Breyer, for more on what led to the decision and what happens next. Bobby, it's good to see you. Thanks for coming in studio. So, yeah, I mean, why did the board make this decision and why now?
Yeah, it's interesting, Bree. When we look at this August 18th board meeting, some of the school board members who voted in favor of ending this contract with CarePlus New Jersey really cited cost. Right now, what was on the table was a contract with that behavioral health service to essentially provide more intense mental health support to students, maybe students who are struggling with, say, suicidal ideation or suicidality. But right now, that contract was looking at just shy of $280,000. But it's interesting because they've had this service in place for about 5 years now. So there was a lot of outrage and kind of confusion overall from parents and students saying, you know, we know this has a positive track record for student mental health, kind of coming as we post-pandemic, we're in the middle still what many experts have called a youth mental health crisis.
Right.
So it's interesting, and so that was the first part of it. Yeah.
Is cost the full picture, though? I mean, was there reasoning from the board that it's not being utilized or that students are getting these services elsewhere? I mean, what's the full scope of this?
You know, cost was that first part. Essentially, when they continued to give their explanation, they said, you know, we already have essentially enough mental health services. We have student counselors and student assistance counselors that could provide these services. But when I talked to parents and some former school officials about this, they really said that, you know, this is not the level of support that is needed for some students that need more intense mental health support, that may be struggling with long-term anxiety and depression, kind of things that are more than just kind of those first day of school jitters, so to say. So this is something that's way deeper than what we're seeing.
So they disagreed with that assessment by the board, and it seemed like from your reporting that the superintendent was stunned.
Right.
And like maybe there's an internal communications issue here about just how badly needed this is.
That's right. You know, the superintendent there essentially said that, you know, she was surprised by the board's decision or disappointed really in this, but she also, throughout the course of that meeting, pointed to the fact that the school couldn't come to a contractual agreement with Hunterdon Behavioral Health. That's their school-based youth service provider, a separate mental health services from what CarePlus provided, that had been providing services for over 30 years to the school. So when you slash those two programs and students are coming back on this first day of school, parents and students are really saying, you know, what are we really left with here, given the history of students dying by suicide in the school? We know that happened in 2017 and 2019, as well as a number of other times. So it's really puzzling, and it's coming at a time when we're seeing other high schools really ramp up their mental health services. So it's interesting to say the least.
Yeah, I mean, this district has not been immune to these issues by any means, as you just mentioned. This is something that they've really been at the forefront in terms of needing to have a system in place and putting one in place. What else is there then? Without CarePlus, without the Hunterdon Behavioral Health, is there anything that can replace it or at least mirror what they had?
Sure. You know, at the time, the superintendent mentioned that they're going to try to contract with outside mental health service providers, essentially like on an as-needed basis. But they also said with the dropping of the school-based youth services program through Hunterdon, essentially now they're eligible for the state's school-based youth services, or excuse me, the NJ4S model.
What is that?
That's essentially aimed to trying to provide more mental health services to more students throughout the state. That's a program that offers different tiers of support to students. So that would be school assemblies, looking at anti-bullying prevention. But if students need more of a higher level of tier support, they would have to fill out an application and eventually be connected with a mental health services provider. While that's available, there are some school districts that are really partnering with outside contractors, such as Effective School Solutions, to provide some more of those higher tiers of support. So there's a kind of a wide array that we're seeing right now of ways to address mental health services. But this is an interesting development out of Hunterdon Central, given what we know.
how are other school districts handling this? I mean, a lot of districts are dealing with budget issues, with less state aid, with less federal aid that is then trickled down. What are we seeing elsewhere? Because you've covered this quite a bit in other districts.
Right, they're partnering, many schools are partnering with places like Rutgers University Behavioral Healthcare or something like Effective School Solutions, essentially these mental health providers that can provide these additional tiers of support. I spoke to the CEO of Effective School Solutions who had essentially said that they're providing these services to 60 school districts for this upcoming school year. It's interesting given the fact of what we know about suicidality in the state, the rise of mental health issues, and really how many populations of young people, including LGBTQ young people, are feeling pressure right now, are feeling anxiety and depression. As we know, over the summer, the federal government cut the Press 3 option for the 988 line for many young people. So this is an issue that we're continuing to see kind of grow. And really, Hunterdon Central, at least at this time, seems to be an outlier in many situations when we see other school districts trying to ramp up as much as they can their mental health services.
Yeah, what's the bigger picture here? I mean, you mentioned it in terms of just how much this problem has grown, the lack of access for some students, especially trans and LGBTQ students. What's the bigger picture about what this might mean for these kids who have relied on a program that's not going to be there now as they get back to school?
For students that can afford it and for families that can afford it, it would probably mean they'd have to go outside of the school to find those additional mental health services. But for students that can't afford it, many are going to be essentially left to their own devices to figure this out. As we know, students are often served best, from what many school officials have said, when they have the ability to access those mental health services in the school or during the school hours. Everybody's schedule seems to be packed these days. So essentially, that idea of being able to get that support while you're in the school building is mostly the most effective way to approach this. It's also something that helps to kind of reduce that stigma among students. If you're able to go to a mental health provider but not have to miss class because of it,
Sure.
You're able to keep up with your schoolwork. Those are the kind of things that we may see. We also may see more of an issue with emergency rooms in terms of a lot of hospitals having to deal with the crisis of if a school or a contractor cannot deal with more intense mental health issues, they may then have to end up sending a student rather to the emergency room. So there could be many ripple effects here that we may not see yet.
Yeah, and I know that we'll be watching for all of those. You can read Bobby Breyer's story on this and all of his mental health reporting on our website, njspotlightnews.org. Bobby, thanks so much.
Thanks, Brianna.